Hi guys, welcome to my channel. In today's video we are going to talk about sudden sensorineural hearing loss. Now with sudden sensorineural hearing loss, as the name suggests, it is a condition that usually affects just one ear without any triggering event. Now with sudden sensorineural hearing loss, the auditory nerve or the hearing nerve becomes infected, caused by a virus. Now, the infection actually causes the auditory nerve or the hearing nerve to become inflamed. Okay. Now, because the auditory nerve goes through the tiny bony tunnel in the skull, once the auditory nerve becomes inflamed, now these bones compressed the nerve, causing auditory nerve dysfunction. Now, once the nerves are unable to function properly, essentially what it means is that whenever sound or any wave or sound is moving from the ear, once it gets to the auditory nerve, the sound may or may not be able to travel along the auditory nerve properly. And once the sound is unable to get to the auditory cortex, then it means you will not be able to make sense out of the information or the sound that got into the brain. All right. So when auditory nerve dysfunction happens, it could be that the inflammation affects the entire nerve or a part of it. So it could be that you may have partial transmission of sound, or the sound may be completely blocked from getting into the auditory cortex for you to make sense out of the information you heard. So the symptoms of sudden sensorineural hearing loss is hearing loss in the affected ear. The person may also have tinnitus, which is the perception of sound in the ear without any external source. I'll drop a video on tinnitus as a symptoms of hearing loss. All right. So the person may also have full clogged sensation in the ear. And you should remember that this condition of sudden sensorineural hearing loss is normally diagnosed after we have ruled out other causes of hearing loss, such as wax impaction or fluid buildup in the middle ear. So when a hearing test confirms that there is a nerve hearing loss, then treatment has to begin immediately. Now, for the treatment, prolonged oral steroids has to be taken. Then afterwards, steroid injection in the middle ear is done. Only when the hearing loss persists after the oral steroid intake, prolonged oral steroid intake. Again, when a person has a sudden sensorineural hearing loss and the diagnosis is made, the earlier you start treatment, the probability that you would have your hearing, like 80% of your hearing back, is high. But mostly we get like 50% of people to get like 80% of their ear back. But if you delay, for example, for about some months or a year, then we cannot do anything about it. So I will advise that anytime you find out that you are struggling to hear or you are unable to hear in one or both of your ear, you need to see an audiologist for ear assessment. See you in my next video. My name is Habiba, and please don't forget to like and share my video. See you